Mindspace, previously known as the CBT Skills Groups Society, offers the Cognitive Behavioral Therapy CBT Skills Groups program, which provides psychoeducation and CBT skills training to individuals with mild to moderate anxiety and depression. The program is delivered by trained psychiatrists and family physicians through 90-minute publicly funded group medical visits. From its inception in 2013 to 2024, the program has served over 15,000 individuals. This initiative was started with seed funding from the Shared Care Committee, a joint collaborative committee of Doctors of BC and the Ministry of Health, and by the Victoria Division of Family Practice. This video shares the story of how this innovative program has evolved and expanded across BC.
The CBT Skills Group program, in my experience, is one of the biggest success stories in healthcare that I've seen and probably that we've experienced.
Primary care providers had been very clear that they needed help with providing access to evidence-based care for their patients. So there was huge demand and frustration at how challenging access was for this population, especially for people with more moderate levels of need.
Incredible leaders in our healthcare community got together, psychiatrists, family physicians, to talk about how they could fill this gap. And they came up with this wonderful idea where psychiatrists could train family physicians to offer these CBT skills groups.
I think it has become part of one of the most important tools in our toolbox for managing mental health, that it would be devastating to community family doctors to lose the program.
There were some really key systemic things that helped us launch this program, chiefly the government introducing the idea of group medical visits. And that just revolutionized how we could approach something like mental health care in terms of economizing as well as capitalizing on group capacities.
We worked hard to integrate the CBT skills program into the kind of continuum of mental health and substance use services that existed within our program, to ensure that our intake team was really aware so that appropriate referrals were provided.
There was a combined vision, and the energy of that really helped us to launch something really new.
The CBT Skill Group is unique in that it supports patients in learning skills that they can use in any aspects of their lives. This is not a duplication of any systems that we currently have. In fact, it allows the systems that we do have to work more effectively.
One thing that we've been learning is that the idea of delivering a health intervention through groups is in and of itself transformative. Time and time again, what we hear from patients and what we experience ourselves is that one of the things that's truly impactful for people is meeting in groups and learning together.
Being able to offer it through an MSP is absolutely brilliant, because it accesses whole huge parts of the population that wouldn't go to therapy, that can't afford it, that aren't interested in it, don't know how to access it. In terms of bang for buck, you get so much out of funding these group medical visits. Yeah, in terms of the cost effectiveness for the system, there's just a profound ripple effect.
I'm definitely seeing my general practitioner a lot less, because I'm not having the side effects of the mental health issues or the depression and the anxiety. I'm able to deal with life a lot better, and I feel stronger, more empowered with dealing with my emotions than I had ever felt in the past.
In 2021, with funding from the Shared Care Committee and by popular demand, Mindspace facilitators began running groups for physicians too. The University of British Columbia, UBC, Continuing Professional Development Department now coordinates this accredited program.
Having gone through the program myself, I can say quite confidently that this program is so valuable in supporting physicians on their journey in providing not only care for their patients, but care for themselves.
When I think about my vision for CBT skills, I would love for it to be accessible to everybody on the planet. Just a small vision. But I really think everybody can benefit from the information in this course. Teaching people how to regulate their emotions and develop flexible thinking and choose behaviors, nurture healthy habits.
I could imagine that this program can provide both a model and also an avenue for delivering more and more types of group interventions that are highly accessible to people across the province.
And I think the real best next step is really looking at that integration piece and looking at how the program lines up with the primary care networks and the services that they provide. I think it's a great opportunity to really link arms and collaborate and see where making sure that patients aren't slipping through the cracks and that the right care is being offered at the right time.
The CBT Skills Group program is an example of what is possible to change the system.
In 2024, the CBT Skills Group Society changed its name to Mindspace, reflecting the fact that physicians are building new and expanded programs beyond CBT skills to respond to the needs of patients. Learn more at www.mind-space.ca.